Hi, this is Dr. Matt Lawless bringing you another knee moment from Knee Fit in 5 and MSM products. Patients often ask me why a total knee replacement will fail, why won't it last forever? So what happens with a knee replacement is we go into the knee and say it's an arthritic knee like this. We cut about 1 centimeter of bone off the tips of this bone and we put a metal cap on. So we make a big cut all the way across. We put a metal cap on the end and we secure that usually with glue, which is actually, well, not glue, sorry, is a cement, which actually acts as a grout and holds the metal in place. On the tibial side down here, we make a very similar cut where we cut about 1 centimeter down right here. We put a metal cap on, and on top of that metal cap, we'd fix a piece of plastic. So the metal and plastic here on the tibia stays in place. Again, the tibial component is anchored to the tibia, so the metal is anchored to the tibia by cement, acts as a grout and holds it in place. Then when you bend and move, instead of the arthritis on arthritis causing the pain, you have metal on plastic, so the nerves are no longer exposed, so it doesn't hurt to walk, bend, or move and use your knee. So why do these fail? Acutely, so within the first year or two, probably the most common reason for failure, one of the most common reasons would be infection. All said, there's probably about a 1% infection rate for doing a total knee. It's probably a little bit less now, but runs around 1%. At our institution, it's actually a little less than that. Factors that play into that are people that are overweight or bigger, with a BMI over 35 to 40 have a higher risk of infection. People that have comorbidities, meaning other illnesses that, especially diabetes is a common one that puts them at a little higher risk. People with inflammatory arthritis, like rheumatoid or something, have a little higher risk of infection as well. So overall, the infection rate's probably about 1%. When you get an infection in a total knee, a lot of times that means another surgery where you have to take the implant in, take it out, sterilize it again, and put a new one in. So that would be one type of failure with a knee replacement. Other times you can have a issue with the cement bonding to the bone or to the prosthesis. This is getting much less rare, but that can cause early loosening, early being less than 5 or 10 years. And the one that usually gets affected is the tibia. So this shin bone here, that's the one that usually gets loose. Sometimes in that one, when you go in to fix it, this femur side is okay, and it just means switching out the tibial side. Another mode of failure, so another way the thing can fail is if they're put in wrong. If they're put in wrong, it might mean that the wasn't balanced properly, or you might have some gapping or ligamentous balancing issues that need to be addressed, and those can be addressed with changing out the metal and the plastic. Another type of failure is a longer term survival issue, and that is where the metal on the femur, again it's rubbing on the plastic here, where that generates little tiny plastic particles. So as you're bending and cycling your knee, walking, you can generate little tiny plastic particles that over time can stimulate some of the cells, the bone cells here, around the components. So remember, the metal is put and held in place with this grout, this cement. Well, if the bone cells are stimulated around there, it can eat the bone away and it will make the components loose, and in that case it needs to be changed out. That's usually a longer term failure, again 10, 20, 30 years, and that's what happens to cause them to fail. So those are the basic modes of failure of a knee replacement, but again, as stated in another video, it's usually a very long lasting replacement that offers good pain control. The survival again at 20 years is probably 70 to 75%. Thanks for listening.